Comissão Europeia adotou a 31 de janeiro de 2018 a proposta de regulamento relativo à avaliação das tecnologias em saúde. Vivemos num mercado global onde uma posição conjunta europeia pode trazer grandes vantagens, como veio a provar-se, por exemplo, durante a pandemia de Covid-19 que paralisou o mundo. Em última instância, o objetivo passa por fornecer informações fundamentadas aos decisores políticos na hora de adotar políticas de saúde seguras, eficazes, centradas no doente e eficientes em termos de custos. Sempre com uma visão multidisciplinar e abrangente, nada como ouvir os nossos próximos oradores, que passo a apresentar e recordar uma vez mais, já há pouco levantei aqui a pontinha do véu, dizer-vos que esta discussão vai ser feita em inglês. Passo então a apresentar os nossos próximos oradores. Jaime Melancia, Presidente da Direção da Plataforma Saúde em Diálogo. Welcome. Uma salva de palmas, por favor. Sim, por favor. Marco Marchetti, graduated in Medicine and Surgery at the Università Cattolica del Sacro Cuore, Italy, and among many other roles, currently he is the Director of the National Center for Health Technology Assessment at the Italian National Institute of Health and the co-chair of the Member State Coordination Group on Health Technology Assessment. An applause, please. Also, Marianne Cossito, she works at Infarmed as Head of Medicine's Evaluation and Access Management Unit at HTA. An applause, please. And Petra Zollner, she directs MedTech Europe's teams focusing on the implementation of the EU regulatory systems for medical devices and in vitro diagnostic medical devices. She represents MedTech Europe to external fora on strategic regulatory policy questions, including the Medical Devices Coordination Group. She also acts as part of MedTech Europe's leadership team, ensuring collaboration and coherence on topics which cross over to the other areas in the medical technologies ecosystem. Thank you so much. Please welcome. An applause. First of all, let's hear each other of them, and we'll start with Jaime Melancia to understand the patient perspective regarding the transposition of European directives.
Agradecer ao Xavier Barreto o convite que fez à Plataforma Mundial para estarmos presentes neste fórum, e não só por isso, também por todas as iniciativas em que a APA tem convidado a plataforma a participar. Muito obrigado. The regulation and evaluation of health technologies in Europe has evolved significantly, particularly with the increasing recognition of the importance of patient involvement. However, despite some positive developments, patients are still not involved enough in decision-making processes that directly affect their health and well-being. While patient representatives have made strides in participating in health technology assessment and other regulatory processes, they often find themselves in the consultative rather than participatory role. Many patients and their representatives are eager to play a more substantial role, recognizing that their lived experience offers critical insights that can shape more patient-centered healthcare decisions. The complexity and technical nature of HTA processes are major barriers to full patient participation. HTA requires specialized knowledge in areas such as clinical research, economics, and biostatistics, making it challenging for patients without this expertise to engage effectively. This creates a gap between the experts conducting evaluations and the patients whose lives are affected by the outcomes. While patient representatives express a desire to be more involved, they feel that current structures are not accessible enough. To bridge this gap, it is essential to implement education and training programs that empower patients with the skills necessary to engage meaningfully in HTA. Simplifying communication and making the process more inclusive would enable patients to participate fully, offering insights that extend beyond clinical outcomes, such as how new treatments might enhance their quality of life. Moreover, while patient involvement exists, it is often limited to gathering feedback or sharing experience rather than playing a direct role in shaping the decision-making criteria. Patients may provide input on how a technology impacts their daily life, but they are involved in determining the evaluation metrics, such as cost effectiveness or clinical endpoints, that ultimately dictate whether a treatment is approved. There is a growing call for co-decision-making models that integrate patients as equal partners in the HTA process. This would allow them to help define goals, outcomes, and criteria used to evaluate health technologies, ensuring that the evaluation reflects what matters most to the people who will be using the treatments. Patients are seeking greater involvement in policy development and regulatory frameworks, but are often excluded from key decision-making discussions. Their participation is usually limited to providing insights after decisions are made, reducing their influence on the frameworks governing treatment access. Many patients want to help shape policies from the start, particularly in early-stage research, clinical trial design, and pricing decisions. Their experiences with chronic conditions, rare diseases, and long-term health challenges provide valuable insights for creating more inclusive and effective health policies. One of the most significant barriers to patient involvement in HTA is the lack of a formal structure requiring their participation across all European countries. While some countries have made progress in integrating patient voices, others lag behind, leaving patients with little to no influence in HTA processes. Even at the European level, approaches to patient involvement are inconsistent. Portugal has been a positive example of progress in involving patients in the decision-making process. The Portuguese regulatory agency, Infarmed, has implemented the Incluir program, which aims to formalize and expand patient and patient association participation in HTA processes. However, we are still the result of a culture strongly marked by paternalism in the relationship with citizens and by the weak incentive for citizen participation in health policies and decisions about their own health. As an example, I would point to the absence of a representative from associations in the HTA Commission, CATS, of Infarmed. In Portugal, patient involvement typically occurs in the initial stages of the technology assessment process. The ongoing revision of our National System for Health Technology Assessment, SINATS, is incorporating active participation by patient representatives, which we hope will mark a significant shift towards more patient-centered healthcare. This involvement ensures that patients' perspectives, including their real-world needs and preferences, are directly influencing how health technologies are assessed and approved. By integrating patient voices into the decision-making process, the revised SINATS framework is expected to create a more balanced approach that considers both clinical effectiveness and cost effectiveness alongside with patient experience. This enhancement in patient involvement is recognized by the regulator itself, which acknowledges that this could and should be expanded to other stages of the assessment process, particularly in the economic evaluation phase. Another crucial area where patients seek greater involvement is in decisions around access and reimbursement. The cost of innovative therapies, such as gene therapies or biologics, often puts them out of reach for many patients, even in well-funded healthcare systems. Patient representatives want to be included in discussions about how these treatments are priced and made accessible to the public. By being involved in pricing negotiations, they can help ensure that the life-saving treatments are not denied due to financial constraints. Furthermore, patients bring a human perspective to discussions that often focus solely on financial sustainability. They can highlight the profound impact that delayed or denied access to treatments has on their lives, making a case for balancing cost control with equitable access to healthcare innovations. Patients are advocating for greater transparency and accountability in decision-making regarding health technologies, as many of these decisions happen behind closed doors, leaving patients to speculate about why certain treatments are approved, rejected, or delayed. Patient representatives are pushing for more open communication between regulatory bodies, healthcare providers, and the public, calling for clear explanations of the criteria used on these decisions. In this context, the need to improve transparency and communication is crucial, exemplified by the proposed creation of an electronic platform, Innovation Tracker, on the Infarmed website. This platform would enhance transparency by allowing citizens, specifically associations representing people living with diseases, to monitor and stay informed about the progress of each funding request process and its approval decision. By demanding transparency, patients can foster greater trust in the healthcare system and ensure they are empowered to make informed choices about their care. At the European level, patients are also working to ensure that health equity is maintained across member states. Significant disparities exist in access to innovative treatments, with patients in lower-income countries often experiencing delays in accessing new therapies. Patient groups are advocating for a more coordinated approach to reduce these disparities, calling for policies that ensure equal access to treatments regardless of geographic location. This would involve creating a pan-European framework that harmonizes the approval, funding, and distribution of new technologies, ensuring that all patients benefit from the latest advance in healthcare. Finally, patient representatives play a vital role in educating and empowering other patients. Many organizations provide the resources that help individuals navigate the complexities of healthcare, making it easier for them to engage with the regulatory bodies, understand their treatment options, and advocate for their own health. By educating patients about their rights and the regulatory process that affect them, these organizations empower individuals to take an active role in shaping their healthcare experience. In conclusion, while patient involvement in the regulation and evaluation of health technologies has improved, there is still much more to be done to fully integrate patients in this process. Patients are eager to take on more active and influential role in shaping healthcare policies, clinical research, HTA decisions, and access to treatments. To achieve this, healthcare systems need to develop more inclusive structures that empower patients, make the process more accessible, and give greater weight to patient input. By involving patients more deeply, Europe can create a more patient-centric, transparent, and equitable healthcare system, ultimately delivering better outcomes for all. Thank you.
Thank you, Jaime, for your reflection. Let's now listen to Mark Marchetti. Welcome to understand the guidelines and the main European trends regarding the evaluation of health technologies.
So, thanks for the invitation. It's a pleasure to be here. I will try to give you an overview of this new HTA regulation that actually is representing the first example all over the world to move the HTA from what was a research contest into a legislative framework. This is the agenda of the presentation, so a brief introduction to the HTR. A description of what are the processes foreseen under the HTR, and also last a mention with respect to an aspect that is not really well known about the regulation, that is called the voluntary cooperation, that is specific foreseen by an article of this regulation. First of all, it should be clear what is the scope of the HTA evaluation. Now I start to call the HTA evaluation I use the terms joint work, European joint work on HTA. So actually, what is the mandate of the European joint work on HTA? To focus on the clinical domains. So the objective of the regulation is to evaluate at the European level the relative effectiveness and the relative safety both of pharma and medical device product. It's not mandatory, it's not in the scope, and this has been a negotiation that has been among the Commission and the Member State. The evaluation also, the other domains of the HTA, organizational, economic evaluation, ethical aspect. Even if the regulation, as we are going to see in the last part of the presentation, leave an open door to expand the scope of the regulation through what is called the voluntary cooperation. So actually, just to give you, a representation of the effort, we are more than 600 persons working hard on the regulation. On the next January, regulation entering into force, it will become operative. I mentioned you that we have, the regulation is applied both on medicine and medical devices. For medicine, with a stepwise approach, we are going to have a progressive implementation of the application of the regulation on all different pharma products. On medical devices, we have a more specific focus on high-risk implantable medical devices and Class 2B medical devices. We need to think about the regulation in not just, related to the HTA, but in a more wider European strategy on health. So in Europe, what we are trying to do is to create a process, an interconnected process among all other institutions, among all other regulation and legislation existing in Europe. Actually, the main actor in this regulation are the EMA, European Medicine Agency, that you know very well have the responsibility on pharma, CHMP opinion, on pharma product, but since January 2001, I also have the responsibility on coordinating the Secretariat of Expert Panel Opinion for Medical Devices. And this is the first connection with the MDR and IVDR, Medical Device Regulation and In Vitro Diagnostic Regulation, that match what is foreseen by these two regulations, expert panel opinion and view for diagnostic tool with the HDR regulation. It means that just a specific type and risk class of medical devices are under the scope, are under the mandatory scope of the regulation. The objective of the regulation is to create an harmonization on evaluation practice all around Europe. It means that the focus on relative effects and relative safety permit to then transfer into the national context, into the member state, these two first domains of the evaluation that are on the basis then of all the process of responsibility, reimbursement and pricing and in different member states. This is the timeline of the implementation of the regulation. You can see that, the story of the HTA regulation is quite longer. There is also another step that we are going to see in a following slide, but the last 10 years of the regulation as foreseen, probably you know the European Network of Health Technology Assessment, Joint Action 1, Joint Action 2, then we have had the Joint Action 3. So we are working in Europe since 2015 to create mainly a network of HTA bodies, of professionals that are involved in the HTA. And then we are working since 2015 to create an harmonization of the methods. So what now you have in the regulation is not coming yesterday. It's coming from more than 10 years of story. And it means that this, is because now we are facing not just with procedural, not just with legislation. So these are just the last results of a long process that beyond have a cultural evolution, beyond have the creation of a network in Europe, beyond have the harmonization of methods on procedure, beyond have the increasing trust among different institutions, different persons working on the regulation. Anyway, regulation has been approved by the European Parliament on December 21, has been entering into force in January 2022, and from the next January 12, start the real application of the regulation. The first two classes of products that go into this regulation are the oncology product and the ATMP product. From January 2026, medical devices will go into the regulation. From January 2028, all products with orphan designation, drugs with orphan designation, and from January 2023, all pharma products that receive an AMA approval will go into the regulation. The main objectives, I anticipate in some way, are to create a framework for the cooperation among different member states, a mechanism to increase the quality of the evidence and at European level, increase the quality of the evidence and have an evaluation of the evidence at the European level. So common rules and methodology. The joint work at the European level on HTA have a name, that is joint clinical assessment. Joint clinical assessment will be the product that will be put available for member states to start with their national process. The key principle of the regulation. Sorry, I need to stand up because I'm not able to see the slide anyway. The joint work on the key principle of the regulation are. This is the first example of the co-legislation. So it's the first example in the European legislation in which the regulation has been driven by the member state, not by the Commission. And through a mechanism that has been, let me say, invented for the first time is an member state HTA coordination group. So the Commission is providing the support, is providing financing, is providing, yes, thanks, is providing administrative support, but is not driving the process. Member State is driving the process. And to come back to previous speaker, I mean, one of the main issues of the regulation to ensure the inclusivity of patient, of professional, and all different stakeholders. So the first time that in Europe has been created, foreseen by the regulation, an HTA stakeholder network, in which you have professional, scientific society, patient association, industry association. And also the role of the patient and the clinical expert has been embedded by the HTA regulation. We have a first implementing act on joint clinical assessment that has been adopted last May that specifically mentions the role of patient and professional and clinical expert in the HTA regulation, in this HTA joint work in the European level. What are the products, the regulation? Joint clinical assessment, joint scientific consultation. Joint clinical assessment is the evaluation of a product when the product is close to the market, both for pharma product, both for medical devices. Then we have other activities, and then we have joint scientific consultation. Joint scientific consultation is quite, is a process that gives the possibility to the HTD developers to ask for an advice, how to plan clinical study development. To go into joint scientific consultation scope, you need not to have already designed a clinical study plan. You need not to have already started with a clinical study for a specific product. This is an activity that can be done in two different ways. It could be done in parallel with EMA, for medicinal product, but also for medical devices. EMA has started in the beginning of 2023 a scientific advice for medical devices. And actually, the joint scientific consultation that is foreseen under the umbrella of the HTA regulation gives the possibility to have a parallel scientific consultation, EMA, HTA coordination group. So there is many different issues that is quite curious. For example, parallel scientific advice is not possible for diagnostic. It's just possible for medical devices, but it's because the AVD regulation doesn't permit this. So this is the connection that we are trying to build among different regulations in Europe. This is the governance body of the regulation. We have a member state coordination group in which who are the member of the HTA member state coordination group? Institution, not person. Institution that has been nominated by the national authority. And so each member state has nominated a serial institution into configuration. Coordination group is have a pharma configuration and have a medical device configuration. Then coordination group have 4 different subgroups that have more an operational mandate. The coordination group is, I can say, the political strategic group that give the orientation to the how to develop, how to implement. Before I was speaking about that the regulation is driven by the member state, it's driven by the member state through this coordination group. What happened in November 2022 when there's been a discussion how to articulate the configuration of this coordination group? That after discussion, member states were agreed that we was in the beginning of a real acute process. So we need to learn how to manage. And we decided, member state decided to have what is being called one joint configuration, in the sense that we maintain the specificity of medical product and medical devices, but we are working together. It means that we are meeting together, because many of the topics are common among 2 different configurations, pharma and medical devices. This is not a permanent situation. We have just reviewed this decision. We decided to postpone this joint one configuration till the end of 2025. But for example, last week we have had the last meeting of coordination group. We decided, because there is the specificity respect medical device and pharma, to have, a certain point for a 2 hours separate meeting, one on medical devices and one on pharma product. As you can see, the stakeholder network play an important role in supporting the implementation of the HTA regulation. At the beginning, I mentioned you the fact that regulation is the first worldwide example to move from a research context to a legislative framework. Regulation provide, some general require input, general obligation, but the detailed procedure, the detailed step, the detailed obligation are listed in what they call implementing act. The implementing act is a tertiary legislation of the European Union. Actually, we have the implementing act for joint clinical assessment of medicinal product that's described in a very detailed way the procedure, the time, the step. The first consequences of this implementing act is that since last June, EMA have changed the submission letter for those HDD developers that have to submit the dossier. So actually, they need to check a box in which they declare that their product are eligible to joint clinical assessment. So this is changing completely the framework of the both regulatory and both evaluation in the European context. Then we have other 2 implementing act of the management of conflict of interest and the exchange of information with the EMEA. It's the first time in Europe that the management of the conflict of interest is have detailed procedure and rules in a legislative framework. It's the first time. And this will have an impact also in those other European institutions. It's supposed that the next two implementing act will be adopted, in the next couple of weeks. Then we have other implementing act that we need to approve before the January 2025. So, joint clinical assessment of medicinal, joint scientific consultation on medicinal product, joint scientific consultation on medical devices, and joint clinical assessment on medical devices. Coordination group is also responsible to provide guidance, methodological guidance, how to evaluate. I mean, one of the first document that is published, for example, is a document that describes how is the methodology to have direct and indirect comparison. So, you know that in pharma more and medical device less, you have this problem not to have direct comparison. So, in many cases, you have indirect comparisons. So this is the first time that in Europe we have a guidelines how to evaluate direct and indirect comparison. And now focus on the medical devices. Which medical devices are in scope for joint clinical assessment? Those medical devices that have had an expert opinion from the expert panel and or a view for diagnostic. These are the medical devices and IVD that are in scope for joint clinical assessment. We have in these medical devices, this is another connection with the MDR and VDR. These medical devices are just class 2B, providing a removal drug from the human body, and class 3 implantable medical devices. These are the medical devices that are in scope for the regulation. Then the coordination group had the possibility to apply further criteria for selection of medical devices. Unmet medical needs, first-in-class potential impact on patient, public health of healthcare system, incorporation of software using artificial intelligence, machine learning technology or algorithms, significant cross-border dimension, major union-wide value adding. And according to these criteria, coordination group can give the information to the Commission which are the medical devices that will be subject on joint clinical assessment. And with this recommendation, European Commission will adopt a specific implementing act listing those medical devices. This is quite important because with this implementing act, a series of obligations start both for HTT developer and for notified body. Just to give you, some number, what is the total number of medical devices we are talking about? This is, the MDR and the VDR has been started in 2017. This is public data coming from the annual service that the Commission does. So from April 2021, when the expert panel process started, to June 2023, these are the last public available data, we had 568 medical devices that were fitting potentially with the criteria of MDR to go into the expert panel opinion process. There is a series of exceptions that finally we had 60 medical devices that went into the expert panel opinion. For diagnostic, the number is lower. Since April 2021, we have had 21 expert panel opinion. For HIVD, just class D is entering in the process for the view by the expert panel. The main, the clinical area in which are these medical devices in the HIVD are mainly cardiocirculatory system, neurology, and orthopedics. These are the medical devices that are more interested by the application of the regulation. This is a quite complex figure that trying to, I'm not going to enter into the detail, but just to give you, an idea of the complexity of the system and how different regulations are talking among each other. So in the top, in the slide, you have two different regulations. You have the MDR regulation, you have the EVDR regulation, and the activities that are provided under these two regulations, scientific advice and expert panel opinion. In the down part of the slide, you have instead the HTA regulation, you have the joint scientific consultation that can be provided in parallel with the EMA, but also just the HTA joint scientific consultation. This is on top of the responsibility of the HDD developers. And then you have the joint clinical assessment. We have in the regulation, I mentioned you the selection criteria. We have different selection criteria to be eligible, for example, for joint scientific consultation, for joint clinical assessment. They are quite similar. From joint scientific consultation, joint clinical assessment, just the last one is changing. In joint scientific consultation, we have the union clinical research priorities, and joint clinical assessment, we have the incorporation of software using artificial intelligence machine learning algorithm. So just to give you an example of how, I mean, it could be the impact of the application. When will be, we start with the MD after January 2026. And then finally, the voluntary cooperation. So during the 4-year negotiation of the regulation, the scope of mandatory activities of the regulation was limited for medical device to Class 2B and Class 3. And for pharma product instead is extended to all pharma product with a stepwise approach. But an open door has been in the regulation. Article 23 foresees the possibility for member states that are interested in working in different areas to start with this work. We had a discussion in the coordination group. Actually, we have 10 member states that are interested in starting with this voluntary cooperation. And we decided to establish a working group in the context of the coordination group that had the first meeting last September 2nd. And the main topic that actually is of interest of member states are digital medical devices. Because even if they are not fitting with the Class 2B or risk, they are mainly to Class 2A, they have potentially a huge impact on the healthcare system. So this is something that is really of interest of member states to try to find an harmonization on this topic. Now we are planning the work on medical devices. We will start in the second part of the next year with the joint scientific consultation on medical devices, and from January 2006 with the joint clinical assessment with medical devices. We will publish after November 28, when there's been foreseen the meeting in which we are going to, or the coordination group in which we are going to approve the work program. And this is foreseen by the regulation. In the draft of the work program that we are reviewing, it's quite important the engagement with the HTA stakeholder network, and it's quite important also the strategic duration of the joint work on medical devices. The application of HTA regulation on medical device is a unique opportunity for Europe to increase the level of the quality of the system, also on medical devices that is quite less unregulated with respect to the pharma product. Thanks for your attention.
And applause, please. Marianne Cossit is our third speaker, and I have a question in advance for you. Well, she works at Infarmed, I'm sorry. What are the challenges of transposing the European standards into national context?
First of all, thank you very much for inviting Infarmed for this session, especially in this lovely venue, so it's a pleasure to be here. I will try to answer your doubts in my speech, and then of course we can
open to questions.
Of course, we can continue our discussion, and hopefully I will not repeat myself according to Marco's extensive and excellent presentation. So here it is. So. The health technology assessment is a multidisciplinary process that summarizes information about medical, patient, social aspects, and also the economic and ethical issues related to the use of health technology in a systematic, transparent, unbiased, and robust manner. The purpose of the HTA is to inform the decision-making on how patients can access these technologies, and the broader objective of HTA is to promote an equitable, efficient, and high-quality health system. Since 1999, Portugal has had a legal framework for the application of these methodologies, managing to create a robust system that brings value to the national health system. In 2004 and in 2004, the European Commission and the Council of Ministers considered HTA as a political priority, recognizing the urgent need to establish an European HTA network. Following this, in 2005, 35 European agencies responded to an invitation of the Commission that led to the activities of EUNETA project, to which Infarmed was a member from 2010 until its end in 2021. Based on this experience, the Commission adopted the proposal for the HTA regulation in 2018. And this proposal was extensively discussed between the Member States and the European Parliament, and an agreement was reached during the Portuguese presidency of the Council of the European Union, and the final text was adopted in December 2021. Infarmed is thereof committed with the European HTA project since an early stage of its development, and not only did it help to develop the European system based on a voluntary basis, but also helped transform it into an European regulation. Its implementations offers an opportunity for us to contribute to a better access at European level, and we are now, of course, in the phase of setting the scene for January 10, 2025. There is a lot of discussion and activity going on to ensure a smooth implementation of the regulation next January. As Marco said, the coordination group was established in 2022, and Portugal is represented by Infarmed. There are currently 4 subgroups created: joint clinical assessments, joint scientific consultations, emerging health technologies, and methodology. Infarmed has representatives in all of the subgroups and co-shares the methodology subgroup. And also, the stakeholder network was established in June 2023, and its objective is to support the work of the coordination group and its subgroups upon request. And I take the opportunity to inform that the European Commission just launched a call for applications to join this network that is open until October 9. The call is addressed to the stakeholder organizations with interest in union cooperation on HTA, including patient associations, consumer organizations, health technology developers associations, health professional organizations, and other relevant non-governmental organizations in the field of health, including clinical and learned societies. So I take the opportunity to invite all the organizations present here today to explore the possibility of joining the stakeholder network. The information is uploaded in Commission site and also in Infarmed site, but I can, if needed, give you also the information via the organization. The coordination group and its subgroups, with the help of the stakeholder networks and the European Commission, are therefore preparing for the entry into application of the regulation in January 25, including the development and adoption of implementing acts, methodological and procedural guidelines. The regulation foresees a progressive implementation to enable the system and the member states to adopt to the new regulation. It is therefore foreseen that the joint clinical assessment for medicines will begin in 2025, while medical devices only in 2026. For joint scientific consultations, we'll start in also 2025. Of course, this is something that is not mandatory. It's a help that the coordination group and the subgroups are giving the health technology developers. And there is a possibility of medical devices can engage in the joint scientific consultations later in 2025. The regulations foresees both medicines and medical devices to be subject to joint work, which Portugal considers of major importance. HTA regulation is therefore an additional challenge, of course, in the area of evaluation and financing of medical devices, identifying, among others, the prioritization of medical devices subject to HTA, the anticipation of the introduction of innovative technologies and signaling emerging health technologies, as well as the need to develop specific approaches for certain types of medical devices, such as digital health. This covers only high-risk medical devices, classes 2B and 3. And in the case of medical devices, they are selected for a joint assessment on the recommendation of the coordination group on the basis of the criteria that Marco already mentioned. In what concerns medicines, and in order to obtain market access authorization, a medicine is assessed by the European Medicines Agency. Its assessment is focused on efficacy, safety, and quality of the medicines. It is a centralized procedure, also based on European legislation, with well-defined criteria and evaluation agreed between member states. It pretends to answer the following questions. Does this medicine work? Do the benefits of the medicine outweigh the risks? Is the medicine of sufficient quality? HTA, on the other hand, its assessment focuses on comparative effectiveness. How does one technology compare to the other technology? Is the new medicine more effective in treating a particular disease? Are the expected costs and benefits cost-effective compared to the alternative healthcare interventions? Will the use of a new medical device result in a better diagnosis or treatment? How to compare a new medicine with an existing medicine, considering the patients, the diseases, and the outcome for the patient. So far, all member states have had different systems. Legislation and procedures were up to now national, and with their own methodologies and procedures. With the HTA regulations, we now have a framework for European cooperation on the HTA, particularly clinical aspects of the assessment, and a common methodology and procedures for joint clinical assessments and scientific consultations. Infarmed and the other agencies in the different member states, of course, will make use of the joint clinical assessment to support its national decision making, and it will be still responsible for non-clinical evaluation, pricing, and decision on reimbursement. At national level, we believe it is important to underline that the methodological guidelines that are being developed are similar to those already in place in Portugal, so the adaptation to the European framework is facilitated in our case. Nevertheless, of course, Infarmed is currently taking this opportunity to revise the national framework of HTA, not only to better adapt to the HTA regulation, but also in other related issues in order to enhance the national process, considering the 10-year experience with the CNATS, our national legislation. For those medicines that are subject to joint clinical assessment, an HTA report will be available in a very early stage of life cycle of the medicines, which means 30 days after the market access granting. This means This means that healthcare professionals and patients will have access to information on the relative effectiveness of this technology. And when the market access holder submits the reimbursement request at national level, Infarmed will use this joint clinical assessment report, streamlining the national process in the first phase of its assessment. In conclusion, the HTA regulation creates a new European system based on high-quality inclusion and transparency of the joint work, and the commitment of all member states and all stakeholders is essential to ensure good implementation of this regulation. Thank you.
Thank you, Marianne. Last but not least, it's essential to listen to Peter Zoellner because MedTech Europe is European trade association for the medical technology industry, including diagnostics, medical devices, and digital health. It's a pleasure to have you here with us.
Thank you very much. Well, it's also a pleasure to be here with you in this lovely room. As you were saying, it looks like a church or a temple of some sort, be a temple to healthcare. My expertise is not, unfortunately, in the area of health technology assessment. I have to confess, I am an expert in the European regulations for medical technologies, so the medical devices regulation and in vitro diagnostic medical devices regulation. So nonetheless, I'm going to make some remarks on the medical devices regulation and then also some remarks on the new and incoming European HTA regulation. And of course, if we think about innovative medical devices reaching healthcare systems, before any opportunity to go through an HTA, we have to have CE marking of our devices, and that is where the medical devices regulation is coming in. The medical devices regulation, it has been with us here in Europe since more than 7 years. It was born in 2017. And this is a product regulation which governs safety and performance of medical devices, including highly innovative implantables and other devices that are eligible potentially to go through the European HTA regulation. The medical devices regulation has brought in significant number of requirements, including, and this is a very short set of examples because there are many more, updated requirements for safety and performance and also for clinical evidence, including how the evidence is generated, a significant increase in oversight, both pre- and post-market, also new requirements for traceability and transparency as well, or potential transparency until the new database is there. And last but not least, I will mention the expert panels, as has already been mentioned. We do have expert panel opinions being given during conformity assessment of high-risk medical devices, but also we now have a pilot early scientific advice being run for those devices. At the same time, what we see is that we've had a lot of challenges with the implementation of the medical devices regulation. So we welcome the medical devices regulation. In practice, if we take its legal framework together with the way it has been implemented, we see a lot of challenges which are leading to concerns around devices availability in some cases, and also concerns around the competitiveness of the wider European medical technologies industry. The industry has been investing heavily in the medical devices regulation, and we see that large manufacturers, many of which are members of my trade association, MedTech Europe, are either fully CE marked under the medical devices regulation or are well on their way to being so. So we have a lot of experience by this point with the medical devices regulation. On the other hand, if we look at the wider industry, more than 90% of which are smaller and medium-sized enterprises, we see that there is a disproportionate impact at the moment on them as they have relatively fewer resources to manage the large amount of requirements and also the rather burdensome way that the regulation currently is implemented. And we see that there's an issue here for devices availability. We see that up to 1 in 3, 20%, 30% of devices for many manufacturer portfolios will be discontinued. We also see from clinicians' surveys that 1 in 2 clinicians say that they have experienced issues with availability of devices since the medical devices regulation was born. And where they have used an alternative, they have said, 2 out of 3 have said that the replacement was less effective than the original. Manufacturers who are discontinuing devices have said that 1 out of 5 products that they intend to withdraw has no equivalent alternative on the market, and 1 in 3 manufacturers has said that they will move outside of the European Union to launch their innovative medical devices first. And that the most commonly cited reasons for all of these trends, as for why devices are struggling to get through the CE marking process, are the unpredictability of the system, the long timelines, so we don't know, will it take 6 months, will it take 24 months, or anything in between to get CE marking, and also the high complexity of the current way that the medical devices regulation has been set up. If we then look at highly innovative implantables, to take one example of devices that may go through the HTA regulation for assessment, they also are impacted heavily by all of these reasons, and more as well is needed for those devices. We see that Europe is the only major jurisdiction in the world today which does not have a pathway for breakthrough innovation. And to compete with the rest of the world, not only do we need a more efficient and predictable system, we should also have a pathway that can deliver highly innovative devices and CE mark them so that patients, in theory, could have faster access to those devices. And elements for such a breakthrough pathway would be, well, first of all, the pathway should support the auditing bodies, the notified bodies giving CE marking to the devices, that they should feel comfortable approving the level of evidence both pre-market and post-market. Currently, we know that notified bodies, along with manufacturers, have liability for devices in case there are major issues with them. And so notified bodies at the moment may feel a little less comfortable knowing they may be more conservative when it comes to giving certification without understanding what is the appropriate level of evidence. Also, scientific advice as well. If we look at a pathway, scientific advice would also be appropriate and should continue to be there, not only during the preparation of the application, but also allowing for a scientific exchange with the developers of the technology during the opinion process, so that questions can be asked and answered. Early dialogue with notified bodies, the auditing bodies, would also be helpful to discuss any regulatory questions, how long it should take and so on, and if there would be a need for any post-market additional controls or evidence needed. And then last but not least, we would see that a pathway for breakthrough innovation should only take, say, 120 days. We should be able to get it done in that amount of time, potentially with a certificate on conditions if needed. Turning now to the HTA regulation. So the medical devices regulation, of course, precedes any possibility for devices to go through the HTA regulation and delivers medical devices, including highly innovative implantables, which are CE marked. I think from everything that I have said until now, it's important not to take for granted that there will be devices available which are CE marked. At the moment, we have quite a pressure on the industry. We should also not take lightly the amount of work, investment, and also the number of clinical investigations which are going into generating the evidence which is necessary for the medical devices regulation pre-market, and also more and more we are being asked to do clinical investigations also post-market. And so it's important that in the implementation of the HTA regulation that the implementation is straightforward and transparent, as colleagues here on the panel have been saying, and also that it does not duplicate or discount on the other side all of the work which has been done under the medical devices regulation. We see lots of course, the area of investigation is comparative effectiveness, comparative safety, but for example, we should not need to redo evidence generated for safety and performance in the context of the medical devices regulation. Also, medtech is incredibly complex. We have a new patent filed with the European Patent Office every 30 minutes. This is a highly innovative and complex area of technologies. And so it's also important that the HTA regulation comes up with methodologies which are specific to medical technologies, which allow a wide use of different kinds of evidence which are appropriate for medtech. And finally, for the HTA regulation, I mean, we were saying, I remember panelist, you were saying one of the key principles is to ensure high quality timelines and transparency for the implementation of the HTA regulation, and we would very much agree. And we think it's essential now to for regulators to develop and publish a clear and comprehensive roadmap for how the HTA regulation will work and how medical technology manufacturers should expect the phases to go. For example, how will the full joint clinical assessment phase be implemented? How will the evaluation of emerging technologies work? How will the joint clinical assessment reports be used in national HTA processes? How will the joint scientific consultation be applied for medical devices? And how will that actually work with the expert panels which are already in place today? So lots and lots of questions where a clear roadmap would be very helpful. So I'll finish by saying that we welcome urgent work by EU regulators to bring improvements to the EU medical devices regulatory framework to make sure that we have a pathway which becomes efficient, innovation-friendly, and well-governed. And we also welcome the implementation of the HTA regulation, and in particular look for a clear and comprehensive roadmap so that all technologies, and taking everything together that I have just said, all technologies, including implantables, can proceed through CE marking and, where selected, also through the HTA regulation to reach patients and health systems.
Thank you so much. Unfortunately, we barely have time to answer to a question. We would need much more time to discuss the undergoing work, but I have a question for you all, and you'll have only just a minutes each one to answer to that question. So my question is, will this assessment will make it easier for all the countries or not? For patients, for instance.
Of course, there is different countries in Europe and different ways of dealing with these issues. But what concerns us the most is that we don't want to see patients in Portugal not having access to some treatments, and we don't know why. And on next door in Spain or other countries, patients with the same condition have access to that treatment. That's we don't want to see that. Yeah, transparency and more involvement of the patients. Like I said before, we have to be involved on all the process, not giving our insights, but also being there and making the decision makers feel that on the other side is a human being. And not all of us need the 2 million medicine, but we suffer as well.
Of course.
And we need to have access to all the treatments and have the right to have a quality of life with a better treatment.
And sometimes it's a question of death or life.
It's a question of priorities.
Mm-hmm. And now listen to Marco. There's been a long way from 2010 until now. Will it be easier to coordinate such different countries with different cultures and realities?
Culture takes time to be changed. And this is the reason because, I mean, as Marianne mentioned, I mean, this is some that has been put into the political agenda since 2024. So I participated to the first EUNETA project, European Network Agency. It was the first time, it was in 2005. First time that HTA body and meets each other, and a long trip has been since 2025. Now we have really, I mean, a network. We are really a trust. We are really sharing methods, and this is it's completely useful. I mean, for sure, we have different member states, different contexts, different procedure rules. But I can say that in this, I mean, since 2022, when we start to meet into this legislative framework, we realize that we have more aspects in common than difference. So it's more convenient for all member states to work all together.
Mm-hmm. Thank you so much. Marianne, is there, do we have any national leverage compared to the rest of Europe? Is there anything that makes Portugal unique?
As I was saying, we have a great amount of experience, and I think this is also recognized by our colleagues in other agencies, in other member states. We are co-sharing the subgroup on methodology, so we are also helping improve the system in that way. And I would just make an important call on the importance of the joint scientific consultations, which at the end of the day, if the health technology developers take this opportunity, because as I said,
it's not mandatory.
It's not mandatory. It's something that the HTDs can ask for. The joint clinical assessment and even for the authorization will be much smoother than
it's important to collaborate and participate.
Yes, and it's also exactly, and also something very important that I think will contribute to the equity of the system for all member states, not only in Portugal, not only for Portuguese patients, is the access in a very early stage of information on clinical effectiveness, independently of the will of the HTD to submit the financing process in Portugal or in Italy, in other member states.
Petra, how do you see the current regulatory landscape evolving since 2010? And what impact do you anticipate it will have on innovation and collaboration with the medical technologies ecosystem?
Wow, what a question. How long do I have?
1 minute.
1 minute. Okay, so...
1.5.
All right, so it has been 7 years, more than 7 years, since the birth of the 2 medical technology regulations for medical devices and diagnostics. In that time, we've had a lot happen within the EU, within supply chains, within implementation of the medical devices regulation and IVD regulation. And now we have reached the stage where I'm very pleased to say that the European Commission has launched a targeted evaluation of the 2 regulations about 2 years earlier than they legally had to do it in order to look at the root cause analysis for why they have had to extend each of the 2 regulations two times each, in order to avoid any impact of availability of devices for patients. So where we are going now, we are going into a very deep reflection period, not only for the European Commission, but also for all member states and stakeholders such as industry, such as patients, such as hospitals and so on, to see, okay, how can we take the current system and improve it? So for me, this is a moment of clear reflection, and we hope it will lead as soon as possible, based on good evidence, based on good discussions, to improvements in our system to make it efficient, to make it innovation friendly, to make it well-governed.
Thank you so much. So thank you all for your contributions and reflections. We needed much more time to go on our afternoon. So please, an applause, a huge applause for them.